Viral bronchiolitis in children. Definitions: bronchiolitis is a viral respiratory condition that affects the smallest air passage in the lungs, the bronchioles. The job of these small branching bronchioles is to control airflow in your lungs. When they become infected or damaged, they swell or become clogged. This blocks the flow of oxygen, although it's generally a childhood condition. Bronchiolitis can affect adults as well. Types of bronchiolitis. Viral bronchiolitis appears primarily in infants. Most cases of viral bronchiolitis are due to the respiratory syncytial virus (RSV). Viral outbreaks occur every winter and affect most children under the age of 1 year old. Bronchiolitis obliterans is a rare and dangerous condition seen in adults, with this disease scarring of the bronchioles blocks the air passage, creating an airway obstruction that can be reversed.
What is bronchiolitis? Bronchiolitis is the inflammation of the lungs caused by a viral infection in children usually less than 3 years old. Symptoms of bronchiolitis can be severe, especially in infants less than 6 months old. Symptoms include wheezing and labored breathing, frequent coughing, mild fever, runny nose, and decreased activity level. Regarding treatment, sometimes less is more. Since the disease is viral, antibiotics won't cure it. They may be used for complications only. Also, breathing treatments with albuterol rarely help and can cause additional side effects, such as increased heart rate and decreased blood oxygen levels. Most cases of bronchiolitis can be managed at home with good hydration and nasal suctioning. Symptoms will often improve in 3 to 5 days. Bronchiolitis is a diagnosis your child's doctor can make with a thorough exam. In that case, their doctor will write a prescription so they may visit the Via Christi suctioning clinic once or twice a day for a few days. Fewer children still might require an admission to the hospital for closer monitoring, IV fluids for hydration, and even a tiny amount of oxygen until their lung inflammation begins to heal. Bronchiolitis can occur several times during childhood, but thankfully is usually more mild each episode. Learn more about nose suctioning by going to viachristi.org/suction.
Application in medicine. Bronchiolitis is more widespread in winter. It's possible to get bronchiolitis more than once during the season. There's no medicine to kill the virus that causes bronchiolitis, but the infection usually clears up within 2 weeks without the need of treatment.
Bronchitis is an inflammation of the bronchial tubes, the airways that carry air to your lungs. It causes a cough that often brings up mucus, as well as shortness of breath, wheezing, and chest tightness. There are 2 main types of bronchitis, acute and chronic. The same viruses that cause colds and the flu often cause acute bronchitis. These viruses spread through the air when people cough, or through physical contact, for example, on unwashed hands. Being exposed to tobacco smoke, air pollution, dusts, vapors, and fumes can also cause acute bronchitis. Bacteria can also cause acute bronchitis, but not as often as viruses. Most cases of acute bronchitis get better within several days. But your cough can last for several weeks after the infection is gone. If you think you have acute bronchitis, see your healthcare provider. Treatments include rest, fluids, and aspirin for adults, or acetaminophen to treat fever. A humidifier or steam can also help. You may need inhaled medicine to open your airways if you are wheezing. You probably do not need antibiotics. They don't work against viruses, the most common cause of acute bronchitis. If your healthcare provider thinks you have a bacterial infection, he or she may prescribe antibiotics.
Pros. You can reduce your child's risk of catching it and help prevent the virus spreading. You should wash your hands and your child's hands frequently. Wash or wipe toys and surfaces regularly. Keep infected children at home until their symptoms have improved. Keep newborn babies away from people with colds or flu. Prevent your child being exposed to tobacco smoke. Cons. Potential complications of bronchiolitis include cyanosis, a blue tint to the skin caused by a lack of oxygen, dehydration, fatigue, severe respiratory failure, and ability to breathe unaided. In rare cases, bronchiolitis can be accompanied by a bacterial lung infection called pneumonia. Pneumonia will need to be treated separately. Issue applying accord. In the surveillance report of the Ministry of Public Health in Ecuador, infections by respiratory syncytial virus (RSV) have their higher incidence in the months of January to April. During 2013, 427 cases were reported positive for bronchiolitis respiratory syncytial virus in children under 1 year of age.